Hello, I'm Eric Garcia. I'm a nurse practitioner student at UTEP in the Adult Geriatric Acute Care Nurse Practitioner program. This is my case presentation number 2 for acute and critical illness number 2 actually. So this patient had a presentation of HPI with abdominal pain, also with jaundice, and she had recently undergone a biliary stent with drain placement, and they let the drain stay in place and discharge her home. She just never followed up with her gastroenterologist or surgeon who performed the procedure, and well, looks like it appears it might be getting clogged again. So her past medical history does include GERD, depression, hyperlipidemia, hypertension, pre-diabetes, sleep apnea, spinal stenosis, seasonal allergic rhinitis, and restless leg syndrome. Past surgical history, she did undergo a cholecystectomy in 2012. She had bladder surgery with sling placement in 1998, and she also had a tonsillectomy as a child. Social history, she denies any smoking, states she does drink occasionally at celebrations, and denies any drug use. Family history, she states is unremarkable, nothing that she knows. Review of systems, everything unremarkable. Her main complaint is itching to her skin. Patient does appear jaundiced as well, so the hyperbilirubinemia is causing some pruritus. Other than that, she is grossly unremarkable. Oh, and as well, abdominal pain. Quick little note, she is XRN. She was a registered nurse for about 25 years in OB, so this patient is pretty involved and opinionated for her care, but she does understand she did not follow up with her GI or surgeon who performed her biliary stent placement with drain. You know how nurses are. We're not the best patients sometimes. Physical exam, again, grossly unremarkable. She does have some tenderness to her epigastric area. She's very hard of hearing. She does have a hearing aid in place. She is jaundiced. She does have a biliary drain present with some thin green drainage, but very minimal at this time. Patient is alert and oriented ×3, normal affect, no rashes or lesions, only the jaundiced. She doesn't appear in any acute distress. Perla is present. Like I said, everything basically unremarkable other than her drain and her jaundice and abdominal pain. Denies any nausea or vomiting. So I followed this patient for a few days. As we continue to go on, her assessment would include, we went ahead and, well, let me just get to the assessment first before I get to the plan. So assessment is elevated liver function tests, elevated bilirubinemia, setting secondary to biliary stent status post external biliary drain placement, jaundice, pruritus, anemia of chronic disease, major depression disorder, hypertension, diabetes mellitus type 2, pre-diabetic, bacterial bloodstream infection per blood cultures, and right upper lobe pneumonia. Plan. Patient is expected to undergo an EUS with ERCP by gastroenterology. But as I said, I was following her for a while, so we consulted gastroenterology to intervene. After they did, she was status post revision by gastroenterology. They removed the old stent, placed a new metal one. It was very tight, biliary drain. So the stent was deployed. They were able to keep the drain in the proper placement, and the drain remains. It is now draining a little better. We added Benadryl for her pruritus. We're continuing to monitor CBC and CMP, transfused as needed, but her H&H has been stable. Electrolytes have needed some replacement. We continued all our home dose medications, which include escitalopram, losartan, hydrochlorothiazide. Her blood sugar was running high, so we began an insulin sliding scale, expected to discharge her on metformin. Blood cultures were positive for, Citrobacter fruendi and Enterococcus facialis. They were sensitive to Cipro, so she was started on Cipro, and we'll continue that as outpatient as well. We will continue Zosyn for the right upper lobe pneumonia. We did test her for COVID-19. She was negative. When we were in her stomach by gastroenterology for the revision of her stent, we had ordered a CT scan prior to the procedure, and it did show a large pancreatic head mass, so we have to add that back in our assessment. Large pancreatic head mass. Gastroenterology was able to biopsy several lymph nodes in her epigastric area, as well as brushings from her biliary stent and drain. Those did come back positive for malignancy, so we did place a consult to oncology for her to follow up as outpatient. She lives in New Mexico, so due to her history of noncompliance, we went ahead and looked up who was in her healthcare plan and reached out to them to set up appointments for her to follow up with. We also had her on DVT and PUD prophylaxis with Pepsid, as well as low molecular weight heparin, Lovenox. Other than that, throughout her stay, patient did recover. Her jaundice had decreased, no longer experiencing the pruritus, and we were able to discharge her home with the drain placement with home health to follow up with gastroenterology, her PCP, and as well as oncology due to her biopsy results. She was informed of all of this and stated understanding, so we discharged her. All her home meds is the same. We only added metformin and the Cipro. Her upper lobe pneumonia did resolve as inpatient, and that's about it. Thank you very much.